Hi, I'm Justin Hun and welcome to Free This Friday. It's my first one ever, and today I'm going to talk about the anatomy of the psoas muscle. So the psoas muscle is quite a cool muscle, and it starts off having connections with the TPs of the lumbar spine, the vertebral bodies and the intervertebral discs, and it runs all the way to the lesser trochanter. We can see it over here, of the hip, of the femur. And it's a really important muscle in lots of conditions of the lumbopelvic region. It's thought in the textbooks, as you guys would know, is described as a hip flexor and also a trunk flexor. Now, the psoas muscle is also very important in rehab circles because it's thought by many to be a stabilizer of the lumbar spine because of its relations with the intervertebral disc. And the other thing that's really important about the psoas muscle is that it's thought to have an important role in centrating the hip because it attaches anteriorly with all the other muscles around that hip area. It tries to keep that ball in its socket and reduce the chances of impingement. So today what I want to show you guys is a couple of different ways to access the psoas. So the main way that you guys would have learned to access the psoas might be actually through the abdominal wall and across and in. Another way that you can get into the psoas muscle is actually at the tendon, at the ASIS, and we have a rough line from the ASIS to the pubic symphysis in that region, and then we have the sartorius muscle go in that direction, and the adductor longus that forms that triangle. And if we identify the ASIS, we'll go a little bit inferior, and we go towards the middle of it. We're going to be able to feel the pulse of the femoral artery. If we go a little bit lateral to that, that's going to be probably about a finger's width of it. It's going to be the femoral nerve. If we go a little bit lateral to that, and in that region there, we are going to be on the psoas tendon in there. Now, to confirm that you're on it, can I get you to push gently with your knee into my hand? And you should be able to feel that tendon come up underneath your finger. So it's a really good region to work on the psoas tendon, as well as all the standard techniques you've learned. So you can apply some gentle inhibition type techniques, compression techniques through there. Other ways you can work it is to get the knees up here, and can I get you to slide your heel back and forth for me, nice and slowly, while I just apply that pressure there. Okay, good. Okay, comfortable enough there? Beautiful. So you can do a pin and stretch type technique. Another variation you can do in people that are quite acute is you can do a PRT type technique. So you then grab hold of the leg and then you take it into flexion. Feel for a position of ease, usually in flexion. You can apply a little bit internal rotation, a bit of external rotation. Feel that muscle soften up underneath your finger and just hold it there for about a minute or so until it releases. So that's a couple of other ways that you can access the psoas. Psoas type techniques can be really important in managing lumbosacral pain. So people with low back pain, people with groin pain. And as part of the anatomy of the psoas muscle, we've got a couple of really important nerves that pass laterally to it. We've got the femoral nerve, which actually passes lateral to it, and we've got the general femoral nerve, which passes right into the belly of right out from the belly of the psoas muscle. And so if the psoas muscle is tight, it can cause a bit of groin pain and perhaps some pain down the leg in the distribution of the femoral nerve. So try that technique out, and I hope that helps you guys out. If you guys are interested in that sort of thing, come and check out a wet lab that I'm running. I've got quite a few of those running throughout the year. So check out the link below and sign up and come and check out the psoas muscle, see all the interconnections of that muscle with the diaphragm, with all the different nerves that pass through it, and also how it dives into the lesser trochanter and all the other musculature around it. It's clearly the best way to learn your anatomy and to get better knowledge of where you are palpating and what you're palpating. So thanks for joining me. Catch you next time.